Greetings, my name is Jeffrey Lowell and I'm a third-year resident in internal medicine at Northwell Hofstra-Zucker School of Medicine and an incoming gastroenterology fellow at the University of Massachusetts Chan Medical School. Today I'll be discussing the remarkable progress in hepatitis C treatment over the past few decades with an emphasis on what treatments are available to patients now. Hepatitis C, first identified in 1989, now has a highly effective treatment options that offer hope to millions affected by this virus. In the early days of treatment during the 1990s, we relied on interferon therapy as a first-generation treatment, which had a modest 10 to 20% cure rate. Therapy duration lasted a grueling 48 weeks and came with significant side effects including flu-like symptoms and depression. Adding ribavirin to the regimen in the second generation improved cure rates to 40 to 50%, but patients still faced those challenging side effects and treatment remained expensive for all. The real breakthrough came in the 2010s with the development of direct-acting antivirals, our current standard of care. These medications represent a revolutionary improvement in hepatitis C treatment. They achieve cure rates exceeding 95% in most patients without decompensated cirrhosis, require only 8 to 12 weeks of treatment, and have minimal side effects. Perhaps most importantly, they're becoming increasingly accessible as insurance coverage improves, costs decrease, and treatment is personalized based on hepatitis C genotype as well as prior treatment failure and severity of cirrhosis. The most commonly prescribed treatments today include Epclusa and Mavorite. Epclusa involves just 1 tablet daily for 12 weeks, while Mavorite requires 3 tablets daily but for a shorter 8-week period. Both treatments are safe, highly effective regardless of hepatitis C type, and available to most patients. The overall treatment process itself is straightforward. It begins with screening, typically done by a primary care physician, which includes testing for hepatitis C antibodies. If positive, we then check viral levels and determine the specific viral genotype. The next step involves assessing liver health, usually through non-invasive imaging to check for any fibrosis, which may be a sign of cirrhosis severity. Once these assessments are complete, treatment can begin with a follow-up viral level check at 12 weeks to confirm cure. Regarding treatment costs, multiple options exist for financial assistance, including insurance coverage, patient assistance programs, and various state and federal programs. Looking ahead, the field continues to advance with goals of making treatments even more accessible, shortening treatment duration further, and ultimately working toward the global elimination of hepatitis C as a public health threat. I hope this overview has helped demonstrate just how far we've come in treating hepatitis C, from lengthy, difficult treatments with low success rates to today's highly effective, well-tolerated options. The key message I want to leave you with is that hepatitis C is now curable for the vast majority of patients, and there are multiple paths to accessing treatment. If you have any questions about the screening process, treatment options, or assistance programs I've discussed, you can learn more on the American Liver Foundation website. Thank you for your attention today.